Good morning, student. This is our fifth lecture from chapter reproductive health. Uh, uh, before of this, we started the new topic, which one is sexual transmitted disease, and we already discussed what is sexually transmitted disease. Sexually transmitted disease, or we also call it venereal diseases or reproductive tract infectious, means diseases that are most frequently transmitted by sexual activities are referred to be as sexually transmitted disease. We already discussed here about gonorrhea, syphilis, and genital herpes. The three STD diseases are we also elaborated in our last lecture. We also described there that STD are a major threat to a healthy society, and one could be free of these infections by following simple precautions like avoid sex with unknown partner, multiple partner, use condoms during coitus activity, and in case of doubt one should go to the qualified doctor for early detection and treatment if it is needed. So in there we discuss there what is gonorrhea, what is the symptoms of gonorrhea, which bacterium is responsible for gonorrhea. Mainly in this chapter, beta, you have to be you have to be learn about the different type of bacteria or virus which causes the disease. Like there is many question. One example, which bacteria or which virus is responsible for gonorrhea. So gonorrhea is due to the bacteria which called gonococcus bacteria or Neisseria gonorrhoeae. Though both are the responsible for gonorrhea disease. We also described there about the symptoms. Symptoms are different in male and female. How they spread, as we said that this is STD, so this is spread from the genital to other parts of the body. We also describe their treatment, there is also one important, you have to be know one treatment procedure we have to be know about their medicinal, like ampicillin 2 gram plus prohibicins together by mouth is good for treatment in the symptoms of gonorrhea. We also described in last lecture syphilis. Syphilis is caused due to syphilis pallidum. Is Trypanoma pallidum is responsible for syphilis. It is also a cord-shaped bacterium. In syphilis, we describe there three stages: first, second, and third stage. Third stage is very crucial. How they spread, first treatment is there: erythromycin, tetracycline, doxycycline, etc. These medicine, this treatment you have to be remember always, because this type of question is generally raised in board in 1 marks questions. Okay, so here we discuss about chlamydiasis. Now start this lecture. In our fifth lecture, we first describe fourth STD, four sexual transmitted disease, as you see in your screen. This one is chlamydiasis. Okay, so what is chlamydiasis? It is usually referred to as simply as chlamydia. Okay, and it is a sexually transmitted infectious caused by bacterium called chlamydia trachomatis. How it spread? So chlamydia can be spread during vaginal, anal, or oral sex and can be passed from an infected mother to her baby during childbirth. So it is more easily transmitted in a teenage girl or a younger woman, as her cervix and opening cervix, as you know, it is the opening of the uterus is less mature as compared to an older woman. If How we identify that this is chlamydia, or symptoms is over there, means in the early stage of the disease patient may few or sometimes they have no symptoms at all, but usually start appearing only after 1 or 3 weeks of exposures. In males with chlamydiasis may have a discharge from their urethra or a burning sensation while urinating. They may also complain of itching over the head of the penis, as you see in your screen. Rarely there could be a testicular swelling with pain. And if we talk about in female, so in female chlamydiasis symptoms is like female with chlamydiasis many complain of abdominal vaginal discharge, of or a burning sensation while urinating, lower abdominal discomfort, lower back pain, uh, feverishness or without nausea, pain during sexual intercourse, and bleeding in between menstrual periods. These are all symptoms in female. And now here treatment is very important. Please note it down. It can be effectively cured with antibiotics, and you have to be remember two name at least. First tetracycline and doxycycline. Okay, so tetracycline and doxycycline, always remember these two drugs name, which prevent chlamydiasis. And it is the infection can be prevented by avoiding multiple sex partners, and restrict yourself to a single sex sexual partners. Okay, so this is about your chlamydiasis STD disease. If we talk about genital warts, so this is the picture of genital wart. This is the picture of HPV, because genital warts is infected by HPV, human papilloma virus. So genital warts are the most common viral sexually transmitted infection caused by human papilloma virus. There are over 100 types of HPV which can affect different part of the body. And uh, if, the virus that cause genital warts is easily passed from one person to another through sexual contact, and anyone who is sexually active can be get a virus. Genital wart symptoms are that the skin of the genital area and around the anus. Commonly genital wart symptoms are flesh colored, soft to be touched bumps on the skin that may look like a surface of a like cauliflower, as you seen in your slide. They often grow in more than one place and may be clustered in large masses. These warts are painless, but they may itching always. This type of development is done in 6 weeks to 6 months after infection, and they can grow rapidly during pregnancy or when a person's immune system is very weak. And how now we go with prevention and treatment. So keep the affected area clean, do not touch that area, wash your hand after touching the warts, avoid sexual contact if it is uncomfortable, apply cold compresses to relieve discomfort, or maybe take actinomycin or a levofloxacin, and abstain from sex play and was skin to skin contact. Stop smoking. Smokers may be more likely to develop genital wart than non-smokers. It will be very important. Please note it down. So, and one more thing, if you have any type of this problem, get the HPV vaccine. It can protect against the two HPV types of cause, 90% of all cases genital warts. So this is all about HPV. Now this one is your next eighth state disease, trichomonasis, and this is the picture of Trichomonas vaginalis. It is trichomonasis protozoan disease, means it is very commonly sexually transmitted disease that is caused by infection with a flagellated protozoan parasite called Trichomonas vaginalis. Always remember their name beta, it's very important for your board point of view, and also because you are in bio student you have to be know about it. So infection is more common in women than in men, and older women are more likely than younger women to have been infected. It will be spread by parasite. It is passed from an infected person to an uninfected person during sex. And in women, the most commonly infected part of the body is lower genital tract, where the men, the urethra. Infected people without symptoms can still pass the infection to other people. 70% of infected people do not have any symptom. Men with trichomonasis feel itching or irritation inside the penis. They feel burning sensation during urine, ejaculation or some discharge from the penis. A woman with trichomonasis may notice itching, burning, redness and soreness in genital area, discomfort with urination, thin discharge is always happening, smell can be there, white, yellowish or green of discharge will be happening from female vagina. And what is now prevention and treatment? First one we have to be know drugs. So prescribe the drug metronidazole. Okay, metronidazole is very important. If you have question, give one treatment of or a drug's name which treat the trichomonasis. You have to write down there metronidazole. Okay, metronidazole is a drug for treating trichomonasis. So having trichomonasis can make it feel unpleasant to have sex, and without treatment the infection can last for a month or even a year. Use condom is safe for this, and it stops the spreading of trichomonasis. Okay, so this is all about trichomonasis disease, which is STD disease. uh, Now here, uh, this one is your AIDS virus. Okay, so this one is your AIDS virus you have, and it's also look like acquired immunodeficiency syndrome. And it is a fatal disease comprising serious clinical condition of various manifestations characterized by underlying cellular immunodeficiency. HIV, HIV is a retrovirus, and previously it is called HTLV3, means human T lymphocyte virus 3. You have two pillars of immune system, T lymphocyte and B lymphocyte. So previously HIV is called as HTLV3, human T lymphocyte virus 3, by Robert Gallo, and LAV means lymphadenopathy associated virus by lung potential. So HIV resides swiftly with T lymphocyte and mainly destroy T4 cells of your body, because these play a central role in maintaining the body response to infection. As I said now, that this is the one pillar of your immune system. Basically, AIDS virus can fracture your pillars of immune system. That's why it is a small to small infection is deadly that harm the host body. So, what is the symptoms of acquired immunodeficiency syndrome means AIDS? So, early symptom of AIDS may be vague and ill-defined. Means they include weight loss like fever, diarrhea, oral thirst, and enlargement of the lymph gland. Not all early symptoms will go to the develop the full body illness, but a number of individuals develop a mild condition known as ARC, AIDS-related complex. In severe condition, the patient may develop pneumonia, Kaposi sarcoma, which is a skin cancer, and cancer of the lymph system. Also, it as a long incubation period. But once it develops, there is a rapid decline in health. And for an individual who develops AIDS, the likelihood of death within a year is a very high. Now here we discuss about transmission of AIDS. So AIDS is transmitted by blood transfusion, hypodermic needles shared by the addicts and male homosexual, or by multiple heterosexual intercourse. It may also be transmitted from infected mother to their child during the birth, and by milk breastfeeding mothers. As for now, the virus is not transmitted by touch, saliva, or the non-sexual contact. So, one there is one question, uh, mostly board organized question, that name the diagnostic test of AIDS. So the diagnostic test of AIDS is ELISA, ELISA. ELISA stands for enzyme linked immunosorbent assay. Okay, beta, please beta, always remember it. uh, Treatment, if we talk about treatment of it, so there is no effective treatment, but yeah, avoiding of drug abuse, and avoiding of promiscuous homosexual intercourse or breast preventive measure. Moreover, those at risk from AIDS should not be blood donors. Our recently introduced drug N-butyl deoxynitromycin have a wholesome promise, but currently AZT means azithromycin, which prevents reverse transcription, is used for the treatment of AIDS. Okay, as we better know that reverse transcription means in next chapter where we discuss about molecular basis of inheritance, we discuss about RNA and DNA. So we also discussed there about central dogma. Means when DNA is copy from DNA, and DNA is made RNA, and RNA made proteins. It is happening in our bodies. But in these virus there is reverse transcription. Means there is no DNA made from DNA, not made RNA, but RNA is changed into DNA. This is reverse transcription, which is in coronavirus. This is also the reverse transcription. That's why it is very problematic that we don't have exact vaccine which prevent them from us. Okay. So patients with relieving anxiety showed increased number of circulating helper T cells, increased immunological capacity, and improve general well-being in our country. The National AIDS Control Organization and other non-government organizations are doing a lot to educate people about AIDS. That one is a major effective treatment. Where awareness is major effective treatment in AIDS. Here one more acid disease is hepatitis B. It is a serum hepatitis caused by hepatitis B virus. Incubation period is 6 to 26 weeks. Virus has an antigen that causes the formation of a special antibody which remain in the blood. Spread can occur from contaminated syringe and transfusion equipment in hospital. So hepatitis B virus can be prevented for a year or even a lifetime, and can improve cirrhosis and possibly cancer of the liver. So hepatitis B caused by hepatitis C virus. It is similar to hepatitis B and often spread by blood transfusion, and caused by cirrhosis and possibly liver cancer. So symptoms, it's a flu-like symptoms like raised temperature, headache and joint pains, loss of appetite with general feeling of illness, nausea, vomiting, irritating rashes, and after 3 to 10 days the jaundice develop in there, and urine is light colored, stool is in light color. Hepatitis B infection will progress very rapidly and seriously to cause drowsiness, confusion, and even unconsciousness, even bleeding from various sites, and acute atrophy of the liver. And treatment prevention, that bed rest until fever has scattered, and take a high calorie diet, take a protein and fat, wash your hand carefully, handling bedpans, and patient or his clothes should be clear, neat and clean. Immunization. Immunization is best present measure of hepatitis B. So beta, this is all about your STD disease. Here your chapter is finished now. I am always trying to be resolve your problem in these videos, but I request you to please uh, see this video, and if you have any query, please share your doubts with me in your Zoom classes. But this is only possible when you are attentive. Okay, thank you.